How much tesamorelin should I take a day? Well, this is a really good question because it's a growth hormone releasing peptide. And when you're pulsing growth hormone, you just want to give it a little nudge. You don't want to be overbearing because there could be some side effects from that. But if you properly dose it, you're going to find enormous benefits. So in this video, what I'm going to do is show you that the American way of more is better does not apply necessarily to tesamorelin or any other growth hormone releasing peptides. I'm also going to show you the right way of dosing it, and stick around because what I'm also going to share with you is a case study and real life scenarios of people who've used tesamorelin. So standard dose in tesamorelin is roughly 1.4 to 2 milligrams a day. And most of us in the health optimization world and longevity space, what we do is we have you on it 5 days out of the week and then cycle you off for 2 days. Some of the studies, tesamorelin is also known as a drug called Agrifta. And Agrifta is FDA approved to treat lipodystrophy in HIV patients who had a lot of this visceral fat and belly fat that was developing. And what they found is they could leave them on tesamorelin for up to 2 years, and they had a massive reduction in visceral fat. They also found many of these patients had fatty liver disease and they couldn't put on muscle mass. So they had enormous amounts of what's called sarcopenia. Their body was in this catabolic state. But just by using tesamorelin, roughly 2 milligrams, 1.6 to 2 milligrams in the clinical trials, they found that they had a reduction of visceral fat, they slept better, they had more strength, and they also had more benefits than the control groups had. When you look at dosing, here's what you want to consider. What do you want to have as an outcome of this peptide? We have a strict policy at Ageless Future. You can go to agelessfuture.com. But in our peptide bypass system, we have a strict policy that we don't want to have any kind of risk to your future health. And so you want to think, okay, what are the goals? Are you looking to get the six-pack and get rid of that visceral fat? That's why a lot of people use this. Do you have liver issues? Because if you have any kind of liver damage, fibrotic liver, cirrhosis of the liver, that can be a really helpful component. Are you looking for muscle preservation? Do you have low IGF-1 levels? So is your growth hormone already low? Are you looking for it for cognitive function? Because if you have cognitive decline, tesamorelin, not only does it activate BDNF, but in the studies, they actually found that men with mild cognitive impairment who were over 60, they found that by using tesamorelin, their executive function improved, their cognitive function improved, and they had a better verbal composite. So they had more fluency in their language. So it can work with all of those, but what's your goal? And that's what you want to establish first. The second thing you want to establish is, what does your blood levels look like? Because in order to get on one of these peptides, we only use prescriptive-based peptides from licensed pharmacies, 503A and 503B pharmacies. Our pharmacists are geniuses. They're very brilliant at what they do. They're structuring the right molecules. They're folding them in the particular way so that we can mitigate risk as much as possible. If you're doing that, then let's get your blood work ran and let's look at some markers. If your IGF-1 levels are high, this is not the peptide for you. If you're not working on blood sugar stability, then this peptide's not for you. So it works really well if you're using it with like retatrutide or tirzepatide or, a GLP-1 agonist. One of our clients who came in, he was 58 years old and he had abdominal weight gain. So he had the typical belly, the dad bod. Dudes, you know how that is. We just our bellies just love to expand. And he had low energy, had poor sleep. And his lab work showed his IGF-1 levels were 98. So at the very low end, we want you to be closer to like 250. On his DEXA scan, he had high visceral adiposity. So he had a lot of fat around his organs. And then when we ran his labs, we also found his ALT and his AST were in the 50s. We got him off alcohol and tesamorelin helped. We got him on tesamorelin and semaglutide because semaglutide, the powerful thing about it is it does turn off that craving. I mean, a lot of my clients, they no longer have the desire for alcohol, which is so nice for me because I want to help you get healthy. But if you're drinking all the damn time, it's really hard for us, okay? So that was me on the soapbox. So I'll get back to business. But you got to get rid of the alcohol. I love it just as much as you do, but these peptides can help overcome that evening desire to use alcohol as a comfort from a stressful day. Just go exercise, take a cold shower. There's a lot of things to do. But these peptides can help mitigate that, and they help you see new opportunities in life. So this patient, we changed his whole lifestyle too. So it wasn't just the tesamorelin, but we started him on using 1.2 milligrams of tesamorelin daily. And we also gave him BPC 157, because if you stack these two peptides, what you're going to see is an amplification of both of them. It's like a symphony. It's like nice if the violinist is up there, but then you get the cello player, you get the little drummer, you get the trumpets, and you got a whole orchestra, and it's going to be powerful. So we got him on BPC 157. We got him on the semaglutide. He noticed after 6 weeks, he wanted to rerun his labs, and so we reran him, and his IGF-1 levels jumped up to 260. And what he noticed too is we looked at his visceral fat. He'd already lost 5 pounds of fat, and he'd had less stiffness in his joints. His headaches were gone, he had better sleep, and he was feeling like himself again. And so these are great things that you can see. The other thing he found is as we reduced his tesamorelin even lower, and then we cycled him off of it, then we got him on CJC 1295 with ipamorelin. And the crazy thing is, just by being on this, he noticed that he got a little flushing, so he got nervous. So if you're ever taking CJC 1295, you notice it does give you this little flushing, and that's just fine. But that flushing impact is part of the activation. And then the ipamorelin is going to give you a nice, even greater spike in growth hormone. In fact, when you stack ipamorelin with tesamorelin, you have about a 40% greater level of growth hormone release. And then when you stack CJC, if you're using CJC and ipamorelin, you're going to have about a 7 times greater result of growth hormone release. So really powerful. What we found after 12 weeks, his waist circumference had decreased by 2 inches. He was showing us on his belt. His sleep normalized, his energy returned, and his joints feel great. So there's some powerful things you can do, but once again, this is not medical advice. This is just me sharing a case study with you. But the key lesson that I learned from this is, number one, you want to make sure that you've got the right testing up front. Number two, you want to make sure that you're stacking these peptides at the right time. And it's really important to take the 2 days off. If you're not working on blood sugar, and if you're still drinking a lot of alcohol, eating a lot of sugar, eating a lot of seed oils, those things are going to get in the way. But if you want to be a hyper responder, you're somebody who exercises every day. We have the 30-30 protocol where you exercise 30 minutes in the morning as the sun's coming up. You exercise 30 minutes at night as the sun's going down, and it just makes life better. So the other thing is stacking the right peptides, and that's why our running your blood labs will see that, okay, maybe you need BPC 157, maybe you need a GLP-1, maybe there's something on the mitochondrial pathways that we need to mitigate. Maybe you've got an infection, that's where LL37 comes in. But we want to make sure that we don't leave any stone unturned, because your health is your most valuable asset. And for those of you who love this video and you want to learn how to stack 2 growth hormone releasing peptides together, tesamorelin and sermorelin, click on the link below, and I'll see you in the next video. Thanks so much for being part of the community. I'll see you there.